Good afternoon, everyone, and thank you for joining us today. My name is Samantha Batko, and I'm a Program and Policy Analyst at the National Alliance to End Homelessness. I'd like to welcome you to today's webinar on successful partnerships to serve survivors of domestic violence. This webinar is the third in a series of webinars on serving survivors of domestic violence. Before we get started, I want to touch on a couple of logistical points. All the lines will be muted throughout the webinar. If you have any questions at any point, you can send them to us through the webinar software. Please type them into the chat box labeled Questions on your webinar control panel, which should be located on the right-hand side of your screen. If you are listening on the computer and having audio trouble, I would encourage you to call in on the telephone. The audio quality is generally better on the phone. At the top of the slide that you can see on your screen right now is a link to the registration for this webinar. So if you're trying to allow other people to register for the webinar, you can send them this link. We will have time at the end of the webinar to answer as many of your questions as possible. While we will do our best to get to as many of them, we probably will not get to all of them. For those questions that we do not get to today, we will follow up after the webinar. Also, please note that a recording of this webinar will be posted on the Alliance's website early next week. A link to the recording will be emailed out to all registrants. As we start today, I'd like to get a feel for who is listening. You should see a poll question pop up on your screen. Today, we are asking how your organization primarily identifies itself. As a domestic violence service agency, as a homelessness assistance agency, as a local, state, or federal government agency, or as a research or advocacy organization. There is also a category of other for people who do not fit into any of the first four categories. I'm going to go ahead and leave the question up for a few more seconds to allow the answers to come in. Okay, 5 more seconds. Great. Thank you. As you can see, it looks like we are predominantly an audience of domestic violence service agencies with a strong showing from homelessness assistance agencies and local and state or federal government agencies as well. Thank you all for joining us today. And now I'd like to introduce today's first speaker, Megan Owens, the Associate Program Director for First Avenues at Hamilton Family Center in San Francisco, California. Megan?
Hi there. So I'm Megan Owens from Hamilton Family Center here in San Francisco. Excuse me, I'm just having a little PowerPoint thing. I'm so sorry. And here we go. So I'm talking today about the Rapid Rehousing Network, which was our partnership with the various domestic violence providers here in San Francisco. Are people having an issue where they're seeing the GoToWebinar page? Okay. So Hamilton Family Center, before the start of the Rapid Rehousing Network, was the first and largest rapid rehousing provider in the San Francisco Bay Area for families, and we were also the first and largest San Francisco provider of shelter. However, we were finding that we were having a difficult time collaborating with domestic violence providers because of both some concern on the domestic violence provider side that we weren't the best place for their families, and because their folks were living a little outside of our traditional shelter system, so our typical outreach patterns weren't working as well. So we decided to partner with La Casa de las Madres and Asian Women's Shelter as part of our launch of our HPRP-funded Rapid Rehousing Network. Previous to the partnership, we're noticing that we were doing a really excellent job stabilizing families with time-limited rental assistance, and that was in a 12 to 24-month locally funded model, and reducing the length of shelter stay in the traditional city-funded shelters for all homeless families. However, we were noticing that the folks who were experiencing domestic violence during our program time were our least successful population, so those were folks who were in a domestic violence relationship while they were living in housing that we were supporting with a rental subsidy, and that we were getting very small numbers of referrals from domestic violence providers, especially proportional to the population that we knew they were serving. So we decided to expressly partner with the domestic violence providers, including paying them for their time, providing training and technical assistance to our staff to better serve their population, and for Asian Women's Shelter, which is really expert in providing culturally competent services to Asian women who may otherwise not choose to leave their domestic violence relationship, paying them for some language advocacy and translation services so that clients would go forward in our program receiving rental assistance and home-based case management in their preferred language and cultural setting of choice. And then additionally, we also set aside a partnership with some youth providers to try to mitigate some of our issues serving folks under 25 with a similar approach. Previous to the Rapid Rehousing Network, folks exiting the domestic violence shelter system were either departing directly to housing, which we understand was relatively rare, or they were moving into the city-funded shelter system that First Avenues had been serving since the start of the program. And then very frequently, folks were moving in with family or friends, and those folks, our domestic violence partners, were reporting to us were the least likely to stay safe and stay away from their partners. With the Rapid Rehousing Network, we saw that we took the lead as the agency, so we were collecting all of the outreach forms and assessing folks for eligibility. We were providing all of the rental assistance, and we were providing all of the primary case management. The partner organizations were responsible for referring folks into the Rapid Rehousing Network, doing our staff training and consultation, and then providing those translation services. What this looks like budgetarily was in about an $875,000 contract, about $4,000 were going to the domestic violence providers. So they're really holding a small piece of the financial portion. One hot topic when it comes to domestic violence and federal housing programs is HMIS. So we were able to develop a Hamilton Family Center operated database, which we had been using previous to the partnership. We were able to modify it so that it would meet all of the data standards of HMIS and have that database approved by our local county government to be used as the alternative to HMIS. So we're actually providing annual and quarterly aggregated and totally anonymized data about the program participants, and that's been approved in an MOU by our domestic violence participants as an acceptable use of family data. So then I just wanted to talk a little bit about the impacts that this is having in our community. As you can see from the yellow line here, our domestic violence survivors in San Francisco have started using the program for rapid rehousing a lot more since the Q4 of 2009, which is when the partnership launched, but it hasn't, because this came along with other resources, we have not reduced the number of general homeless families that we've received. But more importantly, this has actually reduced the unmet need for shelter in San Francisco. So here at the top line, you see the San Francisco's shelter wait list for homeless families, which is not a perfect measure, but a close approximate measure of the total unmet need for family shelter in San Francisco. And as you can see here at the start of the Rapid Rehousing Network, we saw that number decline quite a bit. And then more recently, when we've launched some other initiatives to address families with rapid rehousing, we've seen the decline again. And unfortunately, we do see that when rapid rehousing entries are quite low, that shelter list does increase significantly. Thank you very much.
Thank you, Megan. And now I'd like to introduce today's second speaker, Melissa Erlbaum, the Executive Director of Clackamas Women's Services in Oregon City, Oregon. And Melissa?
Okay, let me see here. I'm getting my screen working. And are you able to see the PowerPoint?
Mm-hmm. And right now, it's just not in slideshow.
Okay, here we go.
Perfect.
Okay. This presentation is actually a little bit long, so I'm going to kind of go through some pieces of it rather quickly, and then if folks have questions or follow-up, they can contact me for more information. I want to talk a little bit about how we've worked. I'm the Executive Director for a domestic violence organization, and we've created a really strong partnership with our housing resources in the community. And through that, we also approach it as a really systemic change within Clackamas County. So a few dynamics about Clackamas County. We are just outside of Portland. That said, we have a mix of urban, suburban, and even federally zoned rural areas, so it's quite unique. There are a few nonprofit agencies in Clackamas County, especially comparative to Portland, and those that are here tend to be long-standing and have sprung up from community-based grassroots. There's a strong county government presence, whereas a lot of the services, social services, are delivered through the county system historically here. CWS, Clackamas Women's Services, has been in existence for about 27 years now, as the only domestic violence provider in Clackamas County because the county doesn't actually provide domestic violence services, but most other social services are delivered through that system. There's a high value on long-standing relationships. There's a lot of room for collaboration. The centralized intake system that existed when we started this project a couple of years ago did not include all the partners. There wasn't a streamlined way for prevention efforts. And most of the people working on homelessness were really focused and entrenched on the HUD continuum of care system, which is great, except for it limited their scope in terms of how we were looking at it from a systems perspective. But the 10-year plan that they had established when I first came on board here did include a vision for prevention, which helped lay the groundwork. So we started by looking at all the players that we needed to have, and we brought them together for a series of meetings. And so that included this list here, which I won't go through each detail, but it was a wide group of people that are involved in the system that would touch a life of a domestic violence survivor. And what was unique about our partnership was we, Clackamas Women's Services and Northwest Housing Alternatives, which is the only homeless family shelter in Clackamas County, led this initiative, which I think was really unique that we came together as the leaders in the process, and I'll talk a little bit about what that looked like. Some of the benefits and challenges of working with domestic violence agencies, as you all may know. The benefits are that most domestic violence agencies have a lot of experience with a coordinated community response, and because of that, they're able to create better systems, better networks. They're able to understand sort of the nuances of working with multiple partners on a problem. There are strong advocacy skills within those organizations that really can help with the landlord outreach piece if they're trained and able to translate those skills to that piece. They have expertise in safety planning and crisis intervention. Many have experience with voluntary services models. They have access to different funding streams than homeless service providers do, and they have an understanding of how trauma-informed services benefit survivors. And some of the challenges, as Megan mentioned, the HMIS system, their strict confidentiality standards. Many domestic violence programs have a less formal experience with the homeless service system. They tend to operate outside of it or in competition with it. Historically, many DV agencies are focused on shelter as a primary means for safety, and so prevention methods or rapid rehousing was a pretty uncomfortable topic for a lot of the domestic violence providers that I've worked with in the past and those that I came in contact with in helping other people expand their partnerships in their communities. And then, of course, resource competition that exists between the two systems. When we started establishing our partnership, these are some of the things that we really looked at very intentionally. And so I won't go through them all in detail, but it's just something if you're looking at establishing a partnership from the beginning, or even if you've established one, but if you're having tensions or issues, maybe going through and just taking some of these basic steps to go through the process again or start the process can be really helpful. Creating our common vision included these aspects, so we all started working on, and when I say we all, I mean Clackamas Women's Services and Northwest Housing Alternatives, the DV and the homeless service provider are at the core of this and have done the bulk of the work. But we brought in the county homeless services the services that the county was providing were also brought in, including a program called Rent Well that helps people deal with past evictions or credit issues or barriers to housing. And we came under this common vision of what is a housing first philosophy, can we all get behind it. We wanted to address the current gaps. We really had to do some strong commitment to joint resource acquisition, which was a little bit uncomfortable at first, but I think in the end has played out really well for us. Streamlining the access point, sharing policies and procedures, looking at data collection from a comprehensive perspective, sharing reporting and evaluation, and then, of course, cultural competency is a really important thing to bring in on the front end. The steps that we looked at to create the system are kind of outlined here. We did a systems map and how it was affecting survivors. So some of the things that Megan pointed out in her presentation were very similar to what we were seeing here. But having that data about how survivors are being served as they're experiencing homelessness because of the violence is a really great systems map to have and will help inform you in the process. That helps us also document the need and determine our target populations. We created a unified assessment. So what we did was the Homeless Service Agency and our agency agreed upon having the same assessment tool, which also helped with cross-training our two agencies on the issues that each agency was facing. And we shared policies and procedures for this program, and then we looked at long and short-term goals outcome measures, so on and so forth. And the reason we did that was because in creating a shared vision, if we were all working towards the same outcomes and outputs for homeless families and survivors, we had a more unified response and were able to work more closely together. These are all the aspects sort of our new system. I just want to point out a couple of highlights. So our county Department of Health, Housing, and Human Services a couple of years ago, when they received HPRP funds, contracted those explicitly to our two agencies, which was pretty unique at the time from what I hear from other communities, that the DV provider and the homeless provider, we pretty much got an equal share. CWS was a little bit less because we were going to be serving a few less people, but we had equal footing and equal contribution in those resources, and that's why we decided to create joint policies and procedures and assessment tools. We also worked to get a 3-year United Way systems change grant so that we were able to really look at this from a systems perspective. And I know that's not always available in all communities, but if you're able to find a capacity grant that really looks at system change, I think it can really help with some of these pieces because as we're talking about partnerships, hopefully these are partnerships that are going to be long-lasting and impact the way that we serve survivors in the homeless service system. And a couple of other things that I've already mentioned, so I won't go through those. And this is a really messy map, but it really kind of shows how it works right now. So we didn't have, and we still don't have, one specific access point in our community because the county owns the Housing Rights and Resources line, which is our all homeless families will go through that. But our agency has our 24-hour crisis line, and anybody that's entering our DV shelter or DV services goes through there. And then CWS has established physical access points throughout the community. So we have access in the rural community, in communities where we see a high number of Latina survivors and other marginalized populations. Then those are referred to CWS or NHA for assessment. And because the Homeless Service Agency and the DV agency are working together on a daily basis, we're able to sort of direct people, do the warm handoff, literally a warm handoff to one another's agencies depending on what's most appropriate. And we're able to collect data in a more centralized way. And then this is just a basic matrix of how people are going through into housing services that's probably familiar with most people on the line. The next one is a lot of boxes, but this is I wanted to show this to the, most importantly, to the other domestic violence agencies. This is actually not the communities, this is ours at Clackamas Women's Services. So in this last 3 years, this is what we've been able to build. And I point this out and happy to answer questions more specifically, but now you have it, that as a domestic violence agency, we have a really, really robust homeless housing services program within our agency, and I think it's absolutely because of how closely we've worked with our homeless service agency to accomplish that. So Northwest Housing Alternatives, our partner, has a very similar matrix for how they serve people too, but the fact that we've been able to serve over 100 households a year, and strictly with housing resources in our domestic violence agency alone, I think is really something to point out. Some of the challenges we faced, of course, when we were working in partnerships with the county, there's the tensions around salary differences between nonprofits and county systems. There were tensions in our community around the continuum of care, and what I mean by that is that everyone at the table was really focused on making sure that we were meeting all the HUD requirements and not necessarily paying attention to the fact that there were other resources that could infuse our homeless service system and should infuse our homeless service system to look at it from a systemic perspective. And then that was sort of in conflict with the 10-year plan, which was sort of forward thinking. So there was some tension around where do we put our time and energy, and we had to address those things. We had a long-standing human rights and resources line. We had internal cultural shifts within partner agencies that are moving from a shelter-based system to a housing-based system, and then just general county budget cuts that people are facing. Here are some of the lessons learned, and I think they're pretty clearly defined on here. I don't know that I need to go through each one of them, but I think for folks who are embarking on this partnership together or, again, already maybe partnering and having some difficulties, these might be some areas to kind of go back to, particularly the cross-agency team building activities and training. So our homeless service provider and ourselves, not only do we go in and train each other's staff, but we also have put resources together to have our staff trained together on issues like trauma-informed care, safety in the home when you're doing home visits. And so that sort of team building that happens, we go to the National Alliance conferences together, is huge in terms of feeling supported and feeling like each program understands each other. And so that, you know, as a domestic violence provider, we can feel confident that the homeless service provider we're working with is using the advocacy skills that we would want them to use with survivors, and that they also feel supported when they're working with our survivors. And so the other stuff is pretty basic. I think it's important to include culturally specific partners. Hamilton Family Center, Megan just talked about that. That was a primary focus for them. We made the error of not including some of our culturally specific partners enough in the beginning of the planning, so that was a lesson learned for us. For outcomes, a couple things to point out. It's been a huge benefit for the community that we're serving. We have seen, actually, pulling up my numbers here, over 85% of the participants that we're serving at Clackamas Women's Services have remained housed over a year, and some of them multiple years, which I think it's actually really closer to a little over 90, but I say 85% conservatively, because we know that some of those we lose contact with after 6 months. And it's important to note that, because a lot of those folks are the folks that we use prevention and rapid rehousing, and not the typical shelter system process that most domestic violence agencies use. So we still have our emergency shelter, and we will continue to keep it. We were able to restore it for people who really needed a confidential location, as opposed to a survivor who may need some additional financial resources to leave, or may want to remain in their home and they're able to safely do so. And so there's been a lot of fear, I think, in the last couple of years from domestic violence agencies about whether or not we're setting people up to fail or not giving them enough. And we've seen really high success rates with the program model that we have. And then we've also seen a 35 to 40% increase in the number of people we're serving with disabilities and language barriers, and I think that's because of our partnerships. And and we've also seen, since we moved to a voluntary services model, over 70% increase in service engagement from our participants. So those are some of the success rates. We've got staff satisfaction is over the top right now, and I think that has a lot to do with the fact that they're able to see that we're individualizing a survivor's needs. We're looking at shelter as not the only option. Where in the housing, services do they best fit? Providing long-term support even after a subsidy ends, and so on and so forth. Our staff skill level has increased because of the training that we're doing across programs and agencies. We're getting a higher level of feedback, rate of return from participants with a high reported satisfaction. And one of the things I think it's important to mention is that even as HPRP money has come and gone and ebbed and flowed, we've been able to maintain that infrastructure. So we've been able to put private revenue in, additional county resources that we weren't getting, because we built that infrastructure and we have all those different housing options and they're successful. We were able to secure other funds, state, county, private, to infuse our system. And so while HPRP may not be our primary funding source anymore, we didn't have to close any of those programs or change the way we were doing business because of that. We also created a very flexible system by having all the different options. We were able to use data to inform what we were doing, because we were collecting it and looking at it across community. Of course, within VAWA standards, we were looking at aggregated data for the DV part of it. And because we worked together, the homeless service provider and the DV service provider, we gained a great deal of political will and capital, and part of that was just being out there and really working with our elected officials, and them seeing the partnership and us being able to demonstrate how efficiently we were using resources in the system and actually reducing the impact that survivors were feeling as a result of homelessness due to their victimization. And then the collaborative fundraising piece was huge, and that can be a very tricky one. But we write most of our grants together that have to do with our program. One of us will take the lead on it, and we'll work together, or we'll coordinate. If somebody's applying for something, the other will hold back. And because of that, we've been able to really keep our community pretty infused with resources. The systems evaluation piece, this may be going into a little too much detail for this webinar, but we looked at the three aspects as we evaluate formative, summative, and program, and I'm happy to answer questions about that. But really, it's sort of looking at how to improve operations and implementation or design. The summative is designed to sort of judge effectiveness, and the program is designed to monitor program success and progress on outcomes. And then the measures of systemic change that we're using when we're reporting to our funders and looking at how well we're doing are these aspects around leadership, collaborative planning, financial leverage, provider infrastructure, credible data, and network of allies. And I'm giving this to you all for in the hopes that as you're working together with your homeless service agencies, your county entities, your DV providers, that you might have some sort of guidance, if you don't already, around what you can present to a funder. And if you're able to sort of capture some of these measures of systemic change, it can make a really strong package for people's investment in the partnership, and then of course also improves your system when you're serving survivors. And then there's my contact information if folks have questions after the webinar.
Great. Thank you, Megan and Melissa. These were both fantastic presentations. And so now I'm going to just show an extra resource quickly before we move on to questions. The Alliance recently released a toolkit on rapid rehousing for survivors, and this toolkit was developed with contributions from a number of service providers, including Clackamas Women's Services, which Melissa is a part of on this call today, including Catalyst Consulting and Training, Home Free in Portland, Oregon, the District Alliance for Safe Housing, and the Washington State Coalition Against Domestic Violence. You can find the training by visiting the Alliance's homepage at www.endhomelessness.org, and then click on the Training tab on the top, and then Rapid Rehousing on the navigation on the left-hand side of the page, and the Domestic Violence Toolkit will pop up underneath Rapid Rehousing after you click on it. I'll also send out a direct link to this resource and a follow-up email to all of today's webinar's participants. And with that, I'm putting up links to those resources and also some other resources on housing for survivors of domestic violence that are on our website that you can visit in the meantime. And I'm going to start with questions. And as I said, I will do my best to get to all of the questions that we get today. And if we don't, I will follow up with you following the webinar, and you can put a question in to the queue by typing it into the right-hand, the dashboard on the right-hand side of your screen. So first, for Megan, since we do have mostly domestic violence service agencies on today's webinar, I'm wondering what is the best way for these agencies to, for lack of a better term, sell themselves to a homeless service agency in their locality? So what, as a homeless service agency, are you in need of that a domestic violence provider can supply, and how should a survivor agency go about selling themselves to you?
That's a great question. So in the San Francisco system of care, it was really clear to us as a rapid rehousing provider that we shared clients with domestic violence service providers as shelter providers, but they weren't getting connected to our rapid rehousing services. So of course, as part of our mission to end homelessness, it was a really natural fit. And then, to be really frank, and our DV providers would agree with me if they were on the call, they were already they were the ones sort of choosing not to be at the table with us. They were very suspicious of rapid rehousing, and they weren't confident that it would work for their groups. So if there are DV providers on the call who have sort of historically not been involved in rapid rehousing activities, but there have been some sort of rapid rehousing or homeless prevention activities in your community, I would encourage you to approach those rapid rehousing and prevention providers now and let them know that you have a new level of interest and that you'd be willing to revisit the topic. Samantha, can I also ask you for a favor? I am so sorry. I forgot to show one of my slides, and I want folks to see this.
Let me change it over to you.
Great. So here we go. This slide is actually a case of a woman who's been featured in the newsletter and been a nice fundraising boon for both La Casa de las Madres and Hamilton Family Center. So this is a single mom who entered our program dependent on CalWORKS. And I want to really call out that she was homeless in a domestic violence shelter for 2 months. This is one of the big systems change successes of the Rapid Rehousing Network in San Francisco. survivors of domestic violence who weren't able to exit directly to independent housing from domestic violence shelter before were spending an average of 8 months homeless in the San Francisco system. That calls other questions about the San Francisco system for homeless families, but with the Rapid Rehousing Network, we've been able to move folks directly out of emergency shelters for survivors into housing. So I think this is also part of just in general starting to share some success and build some culture on both sides, both at the homeless provider services and at the domestic violence provider services, that housing is a solution for both populations has been what's really critical.
Great.
So it's a bit of a circuitous answer.
Thank you. Okay. Let me just move this back onto my screen. And then, okay, so the next, thank you, Megan. The next question I have is for Melissa. And this is kind of a twofold question. I'm folding a couple of questions into one question for you. And it's around your sort of collaborated assessment tool and also your centralized data collection that was on your chart. And so under HEARTH implementation, communities are going to be required to create coordinated entry systems. This being the HUD homeless continuums of care will have to create some form of a coordinated entry system. It's not really clear what that's going to look like exactly yet, but as guidance starts to come out from HUD, can you discuss in more depth some of the work that your community has already done on that, specifically around what your assessment tool focuses on and how you kind of got everybody to the table to agree on one assessment tool to be used, as well as how you're handling the data collection and confidentiality issues. So sort of like the conflict between HMIS and that domestic violence service agencies have to protect and only provide aggregate data, and so like the legal requirements that DV agencies are under when it comes to confidentiality.
Sure. Can you hear me?
Yeah.
Okay. So couple things. Like similar to what Megan described, we did our own internal database and had it approved as HMIS compliant. So that was the first step that we did. And it is problematic in the sense that you're having to use aggregated data to look at your system response. But because we're working so closely with our homeless service provider, I think we're able to distill a lot of the information and get really clear on how people are moving through the system without using any identifying information. So there's a way to do it internally. There's also a couple of databases that exist that are specific to domestic violence providers that are HMIS compliant, and I'm happy to recommend some of those. In terms of assessment tool, that was a long process, but a very good process to go through because it helped us get on the same page about what we wanted to measure and also how we wanted to bring people in instead of screening them out. And that was for both us as well as the Homeless Service Agency. There are a lot of great assessment tools out there now that if folks don't have them on the National Alliance website and other places you can pull from some of the ones that have been working really well. We chose to use a strength-based focus. So we had some initial eligibility criteria questions that are on our assessment that will immediately sort of lead you through this matrix. And I think we actually used Hamilton Family Center's sort of idea first, and I think they've changed theirs, but they're still very similar. Those questions that lead to eligibility kind of, as you fill them out, they push you through boxes that would indicate whether or not somebody might be eligible for certain funds like HPRP or something that's a little bit more rigid. And that gives you that just sort of general, but there are just a few of those questions. And then the other questions are related to barriers that we may need to address prior to looking for a lease for somebody, so getting that information early on. But the questions are designed to be as minimal and as least invasive as possible until we're actually able to guarantee that we're going to be providing somebody with support before we go through and ask them a lot of deep questions about credit history and evictions and so on and so forth. And I know that's a little bit different than a lot of communities, but we really felt that that wasn't necessarily pertinent to us because we have been successful in finding housing regardless of those issues. It was really more in planning on how we were going to address them. And then the rest of the assessment is all strengths-based, so it's looking at what are their strengths to be successful, and then what the tool does is as you go through that, it sort of leads you to kind of tallying these boxes. It's not a score per se, but it's just sort of a weighted measurement tool, and that will indicate some of the housing types that might be most appropriate for the family or individual. And then we discuss that with them. We show them, that sort of matrix, but then they're also allowed the opportunity to make their own decision about it. So as long as they qualify, even if the assessment tool is demonstrating that they probably would be best suited for permanent supportive housing, if they would rather do a short-term rapid rehousing subsidy and they're eligible for it, we would do that, or vice versa. So that's sort of the general assessment tool that we use. And because we're using it, the same tool, across the homeless program and ours, that's where we're able to really get that centralized data. So we can say we each served X amount of people with these barriers, and then those people were successful in this kind of housing, and so on and so forth. So it gets you that macro level data without having to violate any VAWA standards.
That's fantastic. Thank you. So we've gotten a couple of just very program-specific questions, so I just want to ask you both some questions. Can you both give a little bit more specifics on the amount of financial assistance and how you deliver financial assistance in your rapid rehousing programs, and I guess also probably somewhat in your prevention programs in terms of the depth of the amount of financial assistance, so how much of the rent and for how long, and also how long you remain service engaged, either like as it relates to your financial assistance. So does their service go on beyond your financial assistance, or is it tied directly to your financial assistance?
Great. So this is Megan, and the amount of financial assistance is a hot topic in San Francisco, as it's a very high rental burden community. In the Rapid Rehousing Network and most of our other rapid rehousing services, we're providing up to $800 per month for a maximum of 18 months based on household need, and we require that households pay 50% of their income towards rent during the program time. So that creates sort of a natural rental limit that the rapid rehousing households use to search for housing. So for example, a household that was bringing in $600 per month at the start of the program time would pay $300 per month towards rent. The maximum rental assistance in the program would be $800, and so they would go out into the community and look for an apartment that was $1,100 or less based on their choice for the unit that they would like to live in. And then our services are tied to the time that the family is in the rental assistance program, which is based on their need, and we do provide comprehensive social services to folks after they've exited rental assistance if they no longer have a rental assistance need but do have a social services need. And we find that the demand for those services is very low. Folks, once they're able to afford their apartment on their own, are usually quite willing to terminate services.
Okay, great. Melissa?
So ours varies. We're not in quite the rental market that San Francisco is, and so we have a 30% contribution, although if they don't have any income, 30% is no contribution. So we're really flexible with that. And what we did, both the homeless service provider and CWS, we took the amount of money that we had and sort of the target number of people, and this is specific to rapid rehousing, the target number of people that we wanted to serve, and sort of divided it up as like a maximum per household. But then what we did was, on a quarterly basis, assess that so that households that were utilizing less, we were able to move money so that people needing more could have longer or deeper assistance. So it was really a lot of financial management, which is another important piece that I think that why it was so helpful to work with a housing service provider, because I had a level of experience in running homeless programs that I brought to the agency, but a lot of domestic violence service agencies don't have that. And so having that homeless service provider that can really sort of help with those nuances on planning out, how long a subsidy might be and being able to move money around between subsidies as needed is important, really important skill to have. And then, so it ranged. It could be a $100 subsidy, it could be a $1,000 subsidy. It was really sort of dependent on the needs and the program requirements. And then because we had quite a bit of additional private resources and other public resources that weren't quite as restrictive, we were able to either supplement or move people into programs that were more appropriate if they were in rapid rehousing and needed a bit more time. But most folks did that were in the rapid rehousing program stayed with that subsidy and did really well with it. And our services actually are not time limited, so we provide. There's a limit within HPRP, for example, on how long that we can bill, for that service. But our agency doesn't time limit, so we just put them through our general case management, an advocacy or counseling or whatever service they are interested in maintaining, and we let them choose when they are ready to exit the program, and they can come back at any time.
Great. So, Megan, I got a follow-up question to what you just said. There was a question as to what sort of social services are you providing, and so I'm going to expand that a little bit to oftentimes when we talk about rapid rehousing, we're talking about case managers making connections with other systems of care and other community services. So what services are you providing in-house, and what services are you doing connection to? And Melissa, I'd also like you to ask the same or answer the same question if possible.
Great. We're a very connections-oriented program. We do provide home visits about 4 times per year for people who are in our rapid rehousing program. And we do have an on-site computer lab, food pantry, and a therapist who works with families, and those are all entirely optional services for people who are participating in the program. So our most frequent request to continue to engage in services after rental assistance has stopped is for folks to continue to have access to that computer lab, food pantry, or the therapist. Because our therapist is funded with California State First $5, we are required to terminate on-site therapy paid by our agency 12 months after exit from the program, but we are able to provide those services on a transitional basis. We've served some folks with a really extensive history of trauma where we have provided some home visits to help maintain their connections to other services in the community after rental assistance has stopped, but that's been exceptionally rare.
Okay, great.
And so for us, it's a little different. We do more in-house. We do have sort of a connection base when it comes to some of the resources like food, clothing, great partnerships around furniture and that type of thing. We've developed a lot of partnerships with the secondhand stores, I guess is the best way, Goodwill and whatnot, where they're able to give vouchers to our families for furniture, and so we're able to furnish apartments really quickly. And then in terms of actual deeper services, we provide home visits as often as folks want, so that could be once a week, once a month, and we will meet them in their home or somewhere in the community or our office. Counseling is available for adults and children. And then legal assistance and advocacy is available. And then we also have advocates within the Department of Human Services, Child Welfare and Self-Sufficiency Department. And so really what we try to do is link a family with one primary case manager, and they do have some choice around that as well. And then that case manager will coordinate any of the other resources they might need within our agency. But if they do want some systems navigation with child welfare, we can bring in our child welfare advocate to work in conjunction with that case manager and that family. So we typically have, anytime there's a meeting that's occurring across programs within Clackamas Women's Services, it would be the participant and then the 2 advocates or 2 case managers or counselor or whomever to sort of design who's going to do what. And so everyone has an understanding. It's kind of like a co-case management model, but within our own agency, so it's very clear with folks. And then we do have culturally specific services within our agency. We've done that by hiring bilingual, bicultural staff, but also by partnering with Catholic Charities and contracting their staff to be at our office. So we're actually paying Catholic Charities employees to work here to provide that really specific service. And then, of course, linking with our community partners around other culturally specific services. I think that pretty much covers sort of the depth of our support.
Great. And so going along that same sort of, we've gotten a couple different questions about services, and specifically around the concept of voluntary services. Melissa, you specifically said you saw an increase in participation when you moved to voluntary services, and Megan, you also mentioned that a lot of your services are optional or voluntary for the families when they're involved with the rental assistance. Can you both expand a little bit, Melissa specifically in terms of the increase that you saw and also the benefits that you're seeing from the use of voluntary services?
Sure. I guess I'll go first on that one. The benefit, well, we have the numbers to show, and I think this is what's really important because it can be a somewhat uncomfortable switch for folks. There's a lot of fear that if you move to a voluntary services model, or even a misunderstanding of what voluntary services means, for us it truly means voluntary services. I think the only program, some of our HUD, like permanent supportive housing, we have to have a service contract that outlines, that we need to have contact X amount of times because the number of hours that a case manager is putting in is leveraging that rental resource. But for all of our other programs, it's completely voluntary. They have to maintain contact in the housing program with the case manager at least once a month. They can do that by phone, email, whatever means works best for them. And when we changed that, we had over a 70% increase in the service utilization rates, which basically means that we had families that were doing and individuals that were doing exactly what they had to and not really engaging in anything else. And when we lifted the mandate to participate in services, we actually saw a huge increase in the amount of services people were willing to access. And this is in our shelter program and across the entire agency. And I think that has everything to do with the fact that you're not dictating for people what is best for them. You're trusting and really, truly offering them self-determination in that process, which creates a completely different dynamic and a completely different relationship between your case manager and the participant. And it moves you to more of a relationship-based model, which does take some different skill training for staff, and it takes a lot of training around trauma-informed care because you're really moving from an enforcer role or sort of, X, Y, and Z has to happen for you to be successful to really letting the client lead the entire process. And while that can be very uncomfortable at first, we found it to be insanely successful. And I feel like I could do a whole webinar just on voluntary services because it is a big, big topic. But I would encourage folks to really look at that and contact some of the providers that have really, truly moved fully to that model because there is a lot of fear around it. But there is we went through a pretty, about a one-year process that we've actually documented, and I can send that to folks, that talks about how we moved from rules and regulations and mandated services and requirements to completely voluntary-based services. And as I said, the couple of times that we have requirements, what we do is we make sure that that's clearly spelled out, and that we do an agreement on the front end, and that we revisit with folks every time we meet with them to make sure that it's still working for them.
Okay, great. Megan, did you want to add anything to that?
Sure. I just wanted to add, so we also have a primarily voluntary service requirement. We do require that families participating in an ongoing rental assistance program, and again, our average program time is between 12 and 18 months, document for us that they are paying their portion of the rent for all kinds of obvious financial management reasons. And we do require that they meet with us in person once every 3 months. However, we really focus on making that feel quite voluntary. We don't dictate the date and time and other things like that. And so now that we sort of have a culture of voluntary services at Hamilton Family Center, we find that we are able to integrate those contractual requirements and program requirements for people to engage without taking sort of an enforcer stance. Our partner at Larkin Street Youth Services, the primary domestic violence provider that was part of the Rapid Rehousing Network, also noticed that when folks were participating in our Rapid Rehousing program, they were much more deeply engaged in the optional ongoing domestic violence support services at La Casa de los Padres. Even folks who hadn't participated in those mental health and support and other trauma recovery groups when they had been in the mandatory services shelter, which we found quite interesting.
Okay, great. So I got a question that's a little bit complicated, so I kind of want to break it up into a couple of different questions. The first is sort of around eligibility criteria for your rapid rehousing. So if each of you could kind of list out like things that would disqualify a household from being eligible for rapid rehousing, and specifically in terms of this question, does it has to do with income? Melissa, you go first?
Oh, we're all so excited about eligibility.
Yeah.
I can go first or wait.
Megan, go ahead. It's fine.
Okay. So In order to be eligible for rapid rehousing services in San Francisco, according to the group, the HP Providers Group's criteria, folks do need to have some sort of income. In the Rapid Rehousing Network and at Hamilton Family Center generally, we don't have a floor to that amount of income. So we have served people whose only income has been cleaning a house or babysitting a couple of hours a week. So maybe they were making $25 or $50 per month at the beginning of the program. We did require that folks had a plan to either increase their income or reduce their rental burden. And we required folks to complete a HAM tool assessment. That's the Housing Assessment Matrix at Hamilton Family Center. It's available at hamiltonfamilycenter.org, and I'd happily email it around. And that's a scoring tool very similar to the scoring tool that Melissa mentioned, where we use the research that we've done on our history of providing these types of services at Hamilton Family Center to surface some elements that indicate that people are likely to be successful, like having a high school diploma, and some elements that indicate people are unlikely to be successful, like being currently pregnant at the start of a program. But just like Melissa's program, we don't use that as a screen out. We just use that to inform folks of what we think is likely to be the most appropriate housing type for them, and then serve them with the service that they choose.
Okay, great. Melissa?
And similar for us, we have we have served folks that didn't have any income, and those were very specific circumstances. Oftentimes, for us, that was somebody who was unable to work because of the violence they were experiencing, but were very quickly able to return to work when the abuser was not preventing them from doing that. So it was pretty clear at that point, you know, you're working with somebody, you only have a short-term subsidy, and that they've just recently lost their job or left their job, or they've had a long work history, but that's been interrupted by the violence, that we were able to sort of work with them even with no income. But similar to what Megan was saying, we work with there's no floor for our income assessment. And what we need to do then is, you know, it goes back to that sort of individualized support, but then also that really being very conscientious of what subsidies we're giving out and how many people we can serve at any given time. Because if we're serving folks with deeper subsidies for a little bit longer, then we serve a few less people that month, and you kind of work it through that way. But we really sort of looked at, you know, what is the likelihood or the propensity or the strength that would, you know, bring somebody to employment in a certain period of time, and what would that look like?
Okay, great. So along the same lines as that, the sort of second half for this question is, particularly when it comes to survivors, and along the lines of both homelessness prevention and on rapid rehousing, how do you handle situations where a survivor was essentially dependent on their abusive partner for all household income? So, I mean, are those people getting rapidly rehoused? Is it possible to prevent homelessness and have them maintain in their own housing? Probably, Melissa, you probably have a little bit more of this because you're getting, would be a direct contact source for the survivor. So maybe you could start?
Sure. I mean, we absolutely have used both the homeless prevention and rapid rehousing services in those cases. And I don't have the number off the top of my head in terms of how many, you know, how many in any given year that we served would fit into that circumstance, but we've been successful. And it really is dependent on what are the other factors. So what are the other natural supports that they have? What type of recovery is going to be most meaningful to them? So are they needing transitional housing or longer-term housing because counseling or other types of resources are going to be the priority? Or is this a situation where what's going to be meaningful for their healing process is to sort of quickly reintegrate into the community and break down the isolation? So it's really looked at case by case, and it has been successful. And I think it's because of the case management model that we use, which again immediately sort of starts addressing. I think because we're able to provide counseling, we're able to provide that deeper support, that folks have been able to be successful because they're getting sort of all of their deeper needs met within the agency, and they're able to stabilize quicker. And then we have had families who, because the dependency on the abuser was so deep that rapid rehousing was not going to be the best match for them. It was too quick of a turnaround time. And we've looked at, and that's why we built our system to be able to serve those people. So we didn't have to turn them away. We just put them into a different program that had a deeper and longer subsidy. But I will say that we've had quite a bit of success with rapid rehousing, and I think we need to challenge our assumptions a little bit about how we assess people as being successful, and looking at some of those strengths and some of those assessment tools that will help you kind of, decide with the person whether or not, they're going to be able to sort of get income, connect with natural supports, and move forward in a short-term or a long-term situation.
Okay, great. Megan, did you have anything you wanted to add to that? No. Okay. So the next question is specific to sort of the not normal cases of domestic violence. So typically, or in a lot of cases, domestic violence emergency shelters may not allow in men or older children. How, Melissa, is your organization coping with men who are fleeing domestic violence with young children, or a woman who is fleeing domestic violence with older children? And has rapid rehousing been a tool that's been helpful in you being able to meet the sort of diverse needs of diverse survivors?
Sure. So we, our shelter will serve adult male children, so and teens and so on and so forth. So that we've been able to do that. Because we don't sort of have that requirement. However, we're not serving, that's when they're coming in as a family unit. So a single male survivor or an adult male survivor with children is problematic to enter our shelter system, and rapid rehousing has been really successful in those cases also. So it's been just one more tool. Prior to that, we were using sort of longer-term hotel vouchers as our way to provide that emergency assistance, and then working them through the general homeless service system. And because we've been able to have this matrix of options, it's been a lot more helpful for folks. And we've seen great success in that area too.
Great. Megan, have you seen any men referrals coming in through your domestic violence partnership? Megan? Oh, I think we might have lost Megan.
Oh, I'm sorry. We have not seen any referrals from men at this time. We have served quite a few families with teenage boys, and they've been at least as successful as others.
Okay. So we have just enough time, I think, for about 2 more questions. So I'm going to ask the last 2 questions that we've got fairly quickly. Megan, specifically for you, how would what is the best way for a DV service agency in their local jurisdiction to find a rapid rehousing agency? Who should they call in their community to see if anyone's doing rapid rehousing, and who should they be approaching in their community to find out about beginning to make these partnerships happen?
Great question. Most HPRP rapid rehousing programs will be ending very soon, but in general, the local homeless or the Continuum of Care Coordinating Group, wherever that sits, it's often at a county human services agency or comparable county-level organization. We'll have all of the information about who's been awarded rapid rehousing services that are tied to HUD dollars, and that would be a good place to start. If not, it's also becoming increasingly common for some national organizations like Catholic Charities to provide these services on a smaller scale privately. So I would recommend that folks look into national organizations that have a local presence.
Great. Melissa, do you have anything to add to that?
No, that would be my recommendation also.
Okay. And then Melissa and Megan, this is going to be our last question that we have time for today. What is your agency's policies around survivors who reunite with the person that has abused them?
Do you want me to take that first, Megan, or do you want to go?
Go ahead.
Okay. So we don't have, our agency doesn't prohibit that, and so we'll work with survivors regardless of that decision that they make. And of course, we're just talking with them throughout the process, and we actually have those conversations at the front end and continue to have them throughout the time we're working with folks, so that if they do reunite, they're able to feel more comfortable telling us. And what we talk with them about is, how is this going to impact, we actually will work with them sort of from the perspective of how is this going to impact the work that we're doing with you. We're obviously not working with the abuser, and whether or not we continue to work with her in a voluntary services model is really going to be her or him, I should say, but the victim. It's really going to be what they think is best for their family. And actually we've had quite a few. Typically what happens in most cases is either there's a reunification that ends up not working, and we're able to kind of sustain them through that process, and they're not destabilized other than the fact that they've experienced more violence, but their housing hasn't been destabilized in the process. And because we come from that sort of self-determination and we're not going to discontinue services with you, what we have found is that people are more inclined to call us and tell us that that person's back in their life because they know they're not going to be penalized for it or judged for it. And then when it doesn't work, which often is the case, there have been cases where it has, but more often than not, it's part of the cycle that they're going through. We're able to walk them through those pieces. So they're able to call us and say, okay, it's happening again. And we're able to, safety plan and work with them for as long as it takes until they're able or ready to make that break again. And so sometimes we've had to move them to a new location for safety. Sometimes it's been a matter of having that person removed from the home that they're in, so on and so forth. But we don't, all of our services are open to survivors regardless of the relationship with their abuser. And sometimes, I should also say that if we are working with a family and there's still active abuse happening as they come in to the assessment, we're probably going to work with our homeless service provider to put them into their subsidy program and then split how we divide services, so that who we're perceiving as the primary aggressor is being given support through the homeless service agency, and then who we're assessing as the victim is getting support through our agency, and we work collaboratively that way, which has often provided a good strategy. Or if the family isn't really identifying, perhaps the abuser comes back into their life and they're not really identifying any longer as a survivor, we may move them into the partnership with our homeless service agency, and then sometimes they move back to us. And that's why that partnership is so important, because it doesn't disrupt their services or their housing. It just sort of changes who's working with them so that it's as safe as possible for the family.
Okay, great. And that is all we have time for today. I'm sorry for anyone's questions who we were not able to get to. I will do follow-up following this webinar in the coming week. And thank you both to Megan and Melissa. These were fantastic presentations, and the webinar was hugely informative. And thank you all for listening. And I hope you enjoy the resources that are available on the Alliance's website, and there will be more to come. Thank you, everyone, and have a great day.